Periods are a natural process that every woman goes through, yet many experience problems during their menstrual cycle. Understanding why these problems happen is the first step toward finding healthy solutions. This lesson will explain the common reasons behind period problems and provide practical tips for relief. Menstrual health is not just about monthly bleeding. It is closely connected to a woman's overall well-being. Why do women have period problems? Periods can become painful or irregular due to a variety of reasons. One major factor is hormonal imbalance. Hormones such as estrogen and progesterone control the menstrual cycle, and any disruption can cause problems. Stress is another big reason women experience irregular or painful periods. When stress increases, the brain's signals to the ovaries can be disrupted, delaying or even stopping periods. Poor lifestyle choices such as lack of sleep, smoking, and unhealthy eating habits can also harm menstrual health. Being underweight or overweight both disturb the body's hormonal balance. Certain medical conditions like polycystic ovary syndrome, SEOs are common causes of period problems. Common period problems. 1. Irregular periods. Some women get their periods earlier or later than expected, which can cause anxiety. Irregular cycles are often linked to stress, hormonal imbalance, or thyroid issues. 2. Painful cramps, dysmenorrhea. Many women suffer from sharp cramps in the lower abdomen during their periods. These cramps happen because the uterus contracts to shed its lining. For some women, the pain is so severe that it affects daily life. 3. Heavy bleeding. Menorrhagia. Some women bleed more than normal, needing to change pads or tampons very frequently. This can cause fatigue, weakness. Heavy bleeding is often caused by fibroids, hormonal imbalance, or medical conditions. 4. Premenstrual syndrome, PMS. PMS causes mood swings, bloating, and irritability before periods. This is due to hormonal changes in the second half of the cycle. 5. Polycystic ovary syndrome, PCOS. PCOS is a condition where small cysts grow in the ovaries, disrupting the cycle. Women with PCOS often face irregular periods, acne, and weight gain. Solutions to period problems. 1. Healthy diet. Eating balanced meals rich in iron, calcium, and vitamins supports menstrual health. Iron-rich foods like spinach and beans help prevent anemia from heavy bleeding. Omega-3 fatty acids in fish or flax seeds reduce cramps and inflammation. Avoiding junk food, caffeine, and excess sugar can also improve cycle regularity. 2. Regular exercise. Exercise improves blood circulation and reduces stress, which helps regulate periods. Yoga and stretching are especially effective for easing cramps. Even a 30-minute walk daily can support hormonal balance. 3. Stress management. Meditation and deep breathing help calm the mind and balance hormones. Good sleep is equally important for a healthy cycle. 4. Home remedies. A hot water bottle or heating pad on the stomach reduces cramps naturally. Herbal teas like chamomile or ginger tea relax muscles and ease pain. 5. Medical help. If periods are too irregular, too painful, or too heavy, visiting a gynecologist is important. Doctors may suggest medicines or tests to find the real cause. Living positively with menstrual health. Talking openly about periods helps women feel less alone. Schools and families should educate girls early about healthy cycles. Menstrual problems are common, but with awareness and care, they can be managed. Every woman deserves comfort, confidence, and dignity during her period. Conclusion. Periods are a natural sign of health, but problems can arise due to hormones, stress, or medical conditions. By maintaining a healthy lifestyle, managing stress, and seeking medical advice when needed, women can overcome these challenges. This knowledge should empower women to take care of themselves and inspire society to support menstrual health.